what is induction of labor, and do I have to go through it? Well, normally you are supposed to go in labor on your own. So, suppose if there were no doctors anywhere, no midwives, anyone, and you are just, it's a natural process, right? Labor. You will go in labor normally, even if there is no one to take care of you. And this baby is going to come. That's how we are naturally designed. But the reason why there are doctors and midwives and healthcare providers, especially for pregnant women, is because there were a lot of complications which would happen naturally, which would prevent either the delivery to happen and kill the mother or would kill the baby. So chances of that happening to you are very less. But because that used to happen, pregnant mothers, like women per se, there was a time when they would not live beyond the age of 30 because they would die in labor. It was that bad. We were not supposed to live more than 30. So as the medical science went ahead, we started finding out why these women were dying, and they were dying in labor. So then we started finding out how pregnancy can actually produce these changes, which is actually killing women. So we found out many risk factors in pregnancy that can harm you or your baby, right? Our priority will always be you as the mother, but we also want to rescue this baby because we can. But our brains would think that we are in danger all the time. Like if anything goes wrong in pregnancy, our automatic behavior is, am I going to die? Can we do a caesarean? Right? But there are ways to bypass this. And why we want to bypass a caesarean? Because it's complicated surgery. It's a major surgery. You undergo anesthesia and all of that. The chances of you getting complication are less, but then there are consequences with it. And because we are your supposed life saviors, we are preventing you from dying in case that happens, we have to be really sure that we are doing something for you which is absolutely required. So induction of labor is basically wherein we start delivery process before natural labor starts. And this we do in special conditions like suppose you have diabetes in pregnancy, high blood pressure in pregnancy, itching in pregnancy, or your water bag has broken and you're not gone in labor. These are the times, or you've gone over dates and you've not gone in labor, like 40 weeks, 41 weeks, whatever is your country's limit. If you have not gone in labor, then we help you go in labor. Because beyond that, like if we wait for natural labor to progress, there is a risk of either you getting really sick or your baby getting really sick, or you might even lose your baby. That's why we intervene and offer you induction. So there are many patients who ask, why do induction? Why not just do caesarean section? And again, the reason why we offer induction and not caesarean section is because caesarean section is associated with risk of pain, bleeding, infection more than normal labor. And also once you have a caesarean section, the chances of you getting a caesarean section next time are higher. Especially if you want to have many babies, that's not something that you want. Yeah, I mean, you don't know how many babies you would want to have. You don't know if your whatever babies you have are going to be enough for you with this husband. So if that is the situation, we have to try. The only person who can give you that trial so that you don't regret it next time or have complications associated with pregnancy is your doctor, and she might offer you induction. And induction is a process. It might take a little bit longer than you think. Like, of course, caesarean section, you get the time and date and the baby's out and there is recovery. It might really seem like the shortest cut ever, but it is not that safe as you think. And if you can avoid it, that will be great. Patients ask me, so you're saying that normal delivery is absolutely safe, induction is absolutely safe? No, it has its risks too. So we have to really balance it out, and it's our job to keep you safe throughout. If at any point during induction we feel that either you are getting really sick or your baby is going to get sick, we will do your cesarean. And it is that judgment that we need you to trust in us for that. When the patient doesn't trust her doctor and is like really freaking out, that anxiety of the patient is really transferred to your doctor and healthcare providers, and then complications can happen because they are humans too. So my job for you is really like, I want you to like really understand that whatever you are going through in your mind is going to produce your results. So if you are being told that you need to get an induction, I need you to understand why that happens and why you need to trust your doctor. There is a reason why you decided to pick that doctor. So why are you not trusting that doctor? Come on a call and get coached about it if you have doubts around that.